shift gears to what that which we can see and touch. We talked about the mind, right? And it's an aspect of our being that we always want to change. I feel more than our mindset and our spirit. We often want to change our bodies, but our bodies is really made up of more than we assume. And, it is said that you are what you eat, just as it says you are what you think, but it's also important for us to consider all aspects of life as we care for our bodies as women. And they often say that health is wealth. And that is often said from the perspective of taking care of yourself so that you can live to have success and possibly become wealthy. But taking the time to invest in your health has significant benefits for enjoying a fulfilling life. So, zooming into women's health in particular, we are grateful to have with us Dr. Caudrean Benjamin. And before we get started with some of the questions I'd like to ask Dr. Benjamin, can you share a little bit about why and how you got into medicine and why obstetrics and gynecology in particular?
Hi, good evening, everyone. Hope you can hear me okay. Thank you for allowing me to be present and part of the discussion here. Um, Honestly, many years ago, I'm not quite sure how I wanted to become a volunteer, but I became a volunteer at a hospital when I was probably nearing high school. And after my volunteer training, I ended up just based on assignment on the floor for labor and delivery. And I was in Baltimore. I'm from Maryland. And there was a case that came in where a woman came in and she apparently didn't know she was pregnant, didn't know she was pregnant with twins, and she was on drugs. And there was a whole lot of hustle and bustle. And it was really interesting to me, but it was kind of sad because people had not so nice things to say about her. But in the course of things, I ended up taking some of the things that needed to go to the lab, and kind of was looking at placentas, and that really kind of intrigued me. But also how this young woman was treated really, kind of struck my heart. And so I actually didn't want to be a physician. I wanted to be a nurse. I wanted to be a midwife. Back then, midwives were not, a commonality, but that's what I wanted to be. But in the course of, this education and training, I navigated my way and ended up going to medical school. I attended Howard University, which is a very special place, especially for medical school. It's a very close knit place, and you learn not just the medicine, but you learn the art of medicine, different from what I think a lot of people do find in the history of medicine and how we had to take care of each other in different ways with little resources. And now, fast forward 20 plus years ago, 20 plus years forward. I just had my 20-year anniversary last year from graduating medical school. I think most of my classmates and I say that has stuck with us despite all of the ways that we've traversed through the country in different ways of medicine. But learning that was key. So that is how I got into medicine. That's how I chose OBGYN. I was unlike a lot of my colleagues in school where I actually knew when I hit the door that I wanted to be an OBGYN. As I learned more about the specialty itself, I did find that I did like it. I liked the part of seeing patients in the office, learning women as a primary care component, but I like the surgical component. I'm good with my hands and, home surgical skills that have been great. As you come across caring for minority women, there are a lot of women who have a need that surgical treatments could help, but there's a trust factor, so you don't always trust everyone to do that. So I felt I bridged a gap there for a lot of women, and was able to do good work in that realm. So I've been blessed to have a long career, 16 years. I just recently came out of office practice, and I'm working as a medical director now. So I don't have the clinical patient contact as frequently as I did. I still am in the hospital, usually on labor delivery twice a month, but the everyday in and out of seeing patients in the office and going to the OR and being on call, that has come to a halt. And I appreciate what Dr. Griffith spoke on, because we do need to find it, in different spaces of life, you do need time. I have three children who are growing. My mother is living with me. She's got Alzheimer's, and she just turned 80. And, life is different. And I needed some time differently from my regular practice life to navigate some of the things that are happening right now. So I'm grateful for the change. I do miss seeing patients in the office and that community that is built there, because I got to know people very well. People came to me and told me stuff that they didn't tell other doctors. So I felt blessed that I could help people in different ways outside of OBGYN. But certainly there's a space for women, because women are powerful, and we need to know our bodies, and we need to listen to our bodies, and we need to understand that we need to take the time to care for ourselves. In that same token, we have to care for ourselves emotionally, but we do have to take the time to care for ourselves physically, or else we won't be able to care for others in the way that we are driven to do.
Well, Dr. Caudrean, I am so grateful to have been connected with you. And we, if I can be honest, everyone, we just got connected last Sunday.
Mm.
And we had a brief conversation. I shared with her what I was doing, and she immediately said yes. And that speaks to her heart, right? And just your story about how you got into medicine. So I'm so excited. I cannot wait to get to know you more and just to see how, where life take us, right?
Sure. It's
Uh,
my pleasure.
yeah. No, sorry, go ahead.
No, I was just saying it's my pleasure.
Oh, thank you so much. Thank you. And so we have some young girls and young women in the audience. And so we're going to just begin our discussion with our precious young ladies in mind. If you can share with us some key health concerns that you see affecting older girls and young adult women today, and how can we as women help them? What are some of the most important health or habits, I should say, women should model for the next generation?
I think we have to get simple and kind of go back to basics. And we need to understand a lot of what we put in is what we get out of our health and out of our bodies. Sometimes less is more. More is less is not necessarily a key component when it takes, to matters of health. I think we're learning that, but there's a need to get back to basics. And so, it's not so much about weight and body mass as it is about general health. Eating right, eating whole, eating healthy, taking time to eat, making sure we're not overeating, and taking time for exercise and activity. So much of that impacts the development of disease processes, high blood pressure, diabetes, and other, commonality, you know, medical issues that we have, especially in our community. From a standpoint of young women, it can impact fertility. One of the things that I was kind of impressed that I diagnosed commonly was a disease called polycystic ovarian syndrome, or PCOS, which can certainly impact the frequency with which women would have periods. And if they didn't have frequent periods, and that could impact how likely they were to become pregnant, and they could become pregnant. But one of the things that I could impart upon patients, they would get very scared when we found that that's what was going on. If you eat right and you exercise, and naturally what commonly happens is you'll lose weight, then your fertility will increase. But I don't think people really necessarily understand that and know that. And so sometimes we may have an underlying issue or situation, but if we are doing what we can to maximize our health, it can make even a situation that could be a problem less problematic and less stressful for us. So certainly, number one, taking the time to investigate your health, make sure you feel like you're connected with a provider that is listening to you, is caring about the things that you care about, and is guiding you in a way that is helping you investigate your health and navigate good health well, is key from a young age. And just those key components, taking that time for that. And then, there's truth to eating healthy and exercising. Again, it's hard because we don't always have time and sometimes resources. It can be expensive to eat healthier. But even in simple ways, just not doing a lot of processed things and just trying to do, fresh fruits and vegetables and whole grains and lean meats or no meats, and increasing proteins in different ways. Those types of things can be a big help. And if you start those habits young, it's much more likely for you to continue them as you get older, in which case the likelihood of developing diseases is increasing. So if you set the good habits young, it will last a lifetime, truly.
That is such great information. And I like, how you talked about consistency, right? When you start young, that is one of the key things that even as an educator, I try to teach my kids in general, right?
Yeah.
Tell us, what are some of the common health misconceptions that women, particularly mothers, should be aware of?
From the same standpoint of weight and body mass, I think it's a misconception that because you may be thin that you're healthy, and because you may be overweight that you're unhealthy. So I think we need to combat that and help understand no matter where you may be on the scale, the healthy habits are going to supersede what you may see or what you may present. You do have to take care of things that you don't see commonly. A lot of what we do is preventive health. So you may not see outward obvious signs of problems. But that's the whole goal of prevention. Identify, potential starts of problems before they're overtly seen. So doing those mammograms as you're getting in towards the middle age, doing your blood screenings even when you're younger, checking cholesterol, checking diabetes screen, making sure your liver and your kidney function is okay. You'd be surprised at some of the things that people track and follow and identify. Most of the time, things are going to be okay. But again, being in the habit of looking and identifying even what you can't see, despite how you may present outwardly to yourself or to other people, is very key. I think it's a general misconception as well that especially when you're younger, oh, I can kind of do anything. For example, my metabolism might be faster. If I eat out or don't pay as much attention right now, when I get older, I can, get that in check. And again, you can, but it's, a lot of what we experience as individuals is just habit. So leaning into the good habits early will actually keep that in place as you get older. And, it's not a guarantee that just because you're young that, health will be on your side. You really want to lean into the healthy habits as much as possible. None of us are perfect, but trying and being intentional about it will make a difference from the outset.
Yes, I love that. I love that. And even going back to when you were talking about uh, eating healthy can be expensive, right? But it's even more expensive later on in life if you don't invest in your health now. So again, starting those habits now, being consistent and just, developing that conscientious attitude toward being healthy and being whole, right? Mind, body, and spirit. Okay, so let's shift to some questions more geared toward women. What are some of the most common misconceptions women have about pregnancy and childbirth? Especially because you talked about how you got into obstetrics and gynecology.
Well, I think there's a misconception. I think a lot of women just assume it's going to be a quick process. And for some people, it is very quick. And for other people, it may not be so. There's a lot of factors that go into it. And I don't think some people understand that we allow you and as a couple time to actually go through the process and have successful conception. So for patients that are under 35 years old, you know, working on a pregnancy for up to 12 months is normal. You see a lot of patients and they're frustrated because in 2 or 3 or 4 months, they haven't been successful. And, we try and calm them down. If things don't seem like there's a problem as far as, period consistency or other presenting medical issues that you might be able to navigate and maximize for them, a lot of times it is a matter of time. Again, you certainly hear patients that get pregnant very quickly, and that can be frustrating to some, but it's very normal for it to take up to 12 months for those who are under that 35-year-old mark. Over 35, it could take that long, but we don't necessarily recommend they wait that long to present to a provider to be evaluated if they haven't been successful. For those patients, we say after 6 months, if you haven't been successful, then you want to say something, let someone know. Not that there's going to be a problem that you can't, but because time is more of the essence in that scenario, you want to go ahead and navigate looking for any potential impacts earlier rather than waiting. Certainly in the patient who is under 35, if they've been trying and they notice some changes, their periods are not consistent, they are very heavy. There's concern for severe pain. I mean, there's certainly, problems that could be related to hormones, fibroids, or, changes with the makeup of the uterus, endometriosis, in which people have severe painful periods that can impact fertility. Those are medical things that could be addressed that might be identified even earlier than that 1 year mark. That would be impactful. But if they don't have those things, then it is a very reasonable time frame to expect that a year could be the occurrence, and that's okay and that's normal.
Okay, great. And so, how can we as women prepare ourselves then mentally and physically for this stage in life in a better way in 2025 than the generations before us, given that we all of the things that we experience in the world today that cause so much more stress and worry and concern, but also considering all of the resources that we have now that we didn't have before.
Right. So definitely if it's a planned attempt for pregnancy, again, I hate to go back to the same things, but eating right, being healthy as far as exercise and activity, and certainly de-stressing and structuring life differently will make a difference if that's possible. Again, if you don't do those things, people don't do that and they end up pregnant and they're going to be just fine. But if you have something that's at your disposal to do, those things will help improve not only just your success, but your health during the course of pregnancy. If you have a need to decrease, in weight and get to a more healthy weight prior to pregnancy, that's going to be beneficial. It'll help decrease the likelihood of not becoming pregnant. It will decrease the likelihood of miscarriage. It will decrease the likelihood of developing diabetes or blood pressure issues in pregnancy. So, if you have that time available to maximize your health prior to pregnancy, is very, very key, especially when it's a planned process. Um, you know, Mental space is hard. Our life right now in 2025 is extremely difficult. And one thing I do think you certainly, have the stress impacts on so many parts of your life. But I do find a lot of women almost stress themselves out about being stressed out in regard to getting pregnant or being pregnant, in which case that's not helpful. And so I always liken it to tell people, certainly we live in a space of stress, and I hate to be one that always looks at other people, but there's always somebody that's probably got it worse than you. It may not be here in our country, but in other countries, people are in spaces of famine. They're in spaces of war consistently. And in those very, very tough spaces are women who are pregnant. And the majority of them, despite those unfortunate stressors and their pregnancies, are likely okay. And so I think we have to minimize stresses where we can, but not overstress about being stressed, because that's not a help. And in the grand scheme of things, think about our ancestor women. I mean, they went through pregnancy in fields, being, you know, run down and in fields of heat and just things that are unimaginable now. And we're here. So, the stresses that they endured, not that our stressors don't matter, because they do, but we came from a space where, women were stressed, and in a great majority of ways, pregnancies were okay. I will say, as I've done this longer and longer, as I see the whole process, it's amazing to me the number of pregnancies that get to be a full-term baby. I mean, there is an unfortunate situation where miscarriage and things like that can happen. When you look at everything that has to happen, I mean, it's truly a miracle that we get from, an egg and a sperm to a whole human being that came out of another human being in the course of 9 to 10 months. That's miraculous. And the longer I do it, I tell people we can doctor it up and we can science it up all we want and give it all kinds of terms. But at the end of the day, that's a true miracle. So, from something that's a miracle in the miraculous, we have to understand we have some input, but we truly don't have the majority of input, and is not truly in our hands.
Well, Dr. Benjamin, and you mentioned that you repeated some information a bit, right? But I think it's worth repeating because unfortunately, no matter how many times we hear eat healthy, do this, do that, we still don't do it. We still don't do it. So I think it's definitely,
It's a hard thing, especially when time is of the essence and you're so busy and you got, so many demands. It's hard. It takes a lot of intention.
yeah. And a lot of people often ask, like, Aisha, how do you do it? with your kids. And two of my children, I have twin boys, and they both have autism diagnosis. And
Mhm.
so, just with everything that I do, I volunteer, I'm doing this, right? So many
Right.
things. Like, how do you do it? But I would often say the grace of God, and people say, yeah, but how, right? And I have to say that I believe that God has given me the grace to be organized, to think in an organized fashion, and to
Mhm.
just be organized with my life and everything that I do. So, even with like meal prep, I meal prep. So tomorrow, that's something that I'm going to be doing. And guess what? It allows me extra time during the week to do the other things that I want to do, right?
Right.
Because if you take the time to just it's kind of like you're repeating everything that you're doing all at once rather than having to start, do it, and then finish and clean up afterwards, right? You do
Yeah.
it all at once. It just
And
makes
get it
so
out the
much difference. Yes. And the other thing that I love that you talked about is, just knowing that there are people who have experiences that are so far worse off than us. And to speak to that, I would love to say to practice an attitude of gratitude. When we're grateful for what we have, it makes it easier for us to not think about what we don't have, not think about all of the things that we want, right? And that we're striving to attain, including becoming pregnant. And
right.
just again, going back to even what Dr. Monique talked about, just living in the moment, being
Right.
present, right? And that can help. At least I believe that can actually help
Yeah.
someone get pregnant.
I was getting so
Get pregnant, conceive.
stressed and they come in where they just kind of, I hate to say gave up, or they let it not be so focal to their being. And once they almost let go, then it happens. So
Yeah.
I always tell people, don't ever say ain't gonna happen. I've had people in my office that I mean, and based on the book, it shouldn't have happened. And my nurses will call me and I come running back like, what are you doing pregnant? And I'm just so happy for them. And I'm just saying, listen, I ain't saying nothing because clearly, it clearly wasn't me and clearly wasn't you. I've seen more things happen. So I never say never.
I love it. I love it. Well, it has been such a pleasure having you. And, just before we close out with this segment, is there anything else that you would like to share? Any current projects you're working on, books you've written, anything at all? Or any just like like your top one piece of it, probably eat healthy, right? No, but seriously, anything that you'd like to share before we
Well, yeah, I'm not into anything different. Like I said, I just moved into a different role and I'm grateful for it. But I will say I feel like that was a lead on me to say we have to prioritize ourselves as women, and not only just our ourselves and what we do and our mental, but also our physical. And sometimes we do have to take stuff off the plate or do stuff differently because we do have to prioritize us, because if not, we will get burned out is an overused term, but it's true. We have to take care of ourselves, and making sure we prioritize us towards the top of our list of everything that we do have that we do get done well. We have to make sure we're on the list.
Amen. I agree. I agree. Well, thank you so much. I look forward to being in touch with you. There are just so many things that, God placed in my heart to do. And I believe that we were connected. Again, like you said, last week it was divine.
Yeah,
It was certainly a divine connection. So
yeah.
thank you so much,
Thank you for
Dr.
having me.